Hello, and welcome back to Ask a Black Girl, the podcast, your destination for random yet informative, judgment-free conversation. So confession, I get straight up giddy when someone says yes to joining me as a guest on this podcast. There are a lot of brilliant people with very busy schedules who have taken the time to join me for the conversations I have here on ABG. This happened last week during an extraordinary conversation I had with Dr. Damon Tweedy from the Duke School of Medicine and Wesley Wade Jackson, a licensed mental health professional, PhD candidate, and founder/creator of the band movement. Our conversation started off on one of my favorite topics, ADHD. What else? My husband has asked me to stop talking about ADHD at cocktail parties, and Meghan Markle. But it expanded into the full world of neurodiversity, what certain terms mean, what does biopsychosocial mean, for example, and what all of that means within a cultural context. This was an extremely rich discussion, which will inform you, make you laugh, make you think, but most importantly, leave with a sense of hope and understanding. I can't wait for you to hear this, and I'll see you on the other side. Enjoy. Welcome, gentlemen.
Thank you. It's great
to be here. How you doing?
Much. We got a 3-3 here. I'm very excited. This is the inaugural, and this is how I visualize. This is my inaugural 3-person conversation. So thank you for being my guinea pigs. I appreciate it. Where do I find both of you gentlemen joining us from?
So I'm in Raleigh, North Carolina.
Nice.
I am on the border of Raleigh and Durham. I still I want to say Durham, but I'd be perpetrating. I'm in Raleigh right now, but Durham is what I really claim.
So, gentlemen, you take a moment to kind of give us a sense of who you are, what you do.
So I am I'm a psychiatrist by training. And so I work part-time in a VA setting. Obviously, you deal with all sorts of people with different types of problems. So certainly ADHD is one of those for sure that I see. And so I work in that setting. So that's certainly one area of interest for me on that level. I'm also teach medical students. I'm really most interested in teaching because the issue in medicine quite a lot is that people who train in medicine don't really get a good appreciation of how important mental health issues are and how it impacts their physical health in all sorts of ways, all sorts of diagnoses, not just depression or anxiety, but ADHD, everything. It impacts people's physical health as well. And so I'm really a big part of teaching the next generation of students, kind of get next generation of doctors, a better sense of how that all flows. So that's something I'm really passionate about. So, psychiatrist by practice, teach psychiatry to future, doctors who aren't going to be psychiatrists. And I'm also interested in writing about medicine and psychiatry and how it all makes sense. I'm really big into narratives because, medical school is very much into the nuts and bolts, the data, all that's really important, but it's also really important to attach, the human element to it, the stories. And so that's been a big part of me as well. So I've written 2 books that sort of touch on that and my own journey with it, but also my journey with patients. And so those are the kind of 3 things that really kind of fill my days. And on a personal note, I'm a dad, got two kids. As far as ADHD, I've never been formally diagnosed, but certainly there's all kinds of things we could maybe talk about that touch on that as well.
Amazing. Thank you. We'll dig into that in the book and everything soon. What about you, Wes?
Well, first, I love how Doc over here is yeah, I'm interested in writing. I'm interested in writing. I haven't published books yet. That's on the horizon, right? So I have my own private practice here in Durham. It is called Ford Counseling and Consulting. I do mental health counseling. I also do coaching for folks, not just in North Carolina, outside of all across the U.S. as well. I primarily focus on areas of neurodivergence. So it's ADHD, dyslexia, autism, the relation with those, and anxiety and career, just managing your life. This is not what I thought I was going to be doing, right? I kind of thought that I was probably ADHD when I was in my late teens, when I started noticing that all of my friends were also ADHD. I was never able to get a diagnosis, never sought one out. And it wasn't until much later, after a few career changes that I had, that I realized, oh, this is a thing. And then I was in grad school here at a HBCU in Durham called North Carolina Central University, where I was like, oh, this is me, like reading the DSM and ADHD criteria for it. Like, this is definitely me, definitely combined. Learned more about it in terms of context and the lack of understanding, awareness, the subjectivity and how we diagnose these things, and started working in the university system to create some programs for students on the autism spectrum. That is a lot of the work that I was known for here in North Carolina, and working on my PhD now, writing my dissertation about Black neurodivergent adults and how they navigate their careers and how racism and other mental health conditions impact that when they are Black and neurodivergent, which is the band, which is I got now. So there's a lot of different moving parts. That's roughly my introduction to this, is that this was me. And I started finding out more that this was me as I was having challenges in my careers during my 20s and early 30s, and just kind of found this niche. And now I'm just establishing some roots in this niche and trying to make some models that help folks outside of the traditional therapy walls, right?
I love it. If only I had some smart people, credentialed people on this podcast. Yikes. So I love this. This is supposed to be Ask the Experts. So you guys are experting for me here. I love it, because something I thought about when you guys were talking about is I want to help with vocab words for people that might be watching this, especially people that know me, because I feel like sometimes I throw these things out, and we're in a world where people throw things out on social media and TikTok, whatever it is. What is neurodivergence? What's the difference between being like, what's the proper way to call the bucket under which all this follows?
Imagine that we probably have different thoughts and feelings and trainings behind that. You know, I was trained in a mental health model. I'm a counselor by training, so I don't operate in the medical model the same way a psychologist and a psychiatrist would, like Damon over here. And so for me, neurodiversity is just it's a theory. It's a 3-part theory. It contains a lot. Neurodivergence is a label within that theory to talk about folks who have conditions such as ADHD, autism, dyslexia, dyspraxia, Tourette's, dyscalculia, all these other things. But it's a grassroots terminology, and in etymology, words change, they're fluid. And so you talk to some groups of folks who I know who are actually kind of on the founding ground of that term and some of the other theories behind this, and they'll include traumatic brain injuries and other things like that. The way that I really see it is that your neurological profile is not what we deem as typical, right? And I'm saying typical as in like statistically average. I'm not saying like there is a normal. It's just like what we see statistically on average by the data that we have. So I also use identity first language. There is some studies out there that show adults who are autistic or adults who are ADHD tend to prefer identity first language. That's saying I'm ADHD, I'm autistic, versus saying I am a person who has ADHD, or I'm a person who is or who has autism.
Because what's the difference? Because I have a friend who has a son with autism, and granted, this was 15 years ago, but she would always correct me and say, no, so-and-so has autism. He isn't autistic. Has the script flipped on that?
Yeah, I think there's been a shift. Over the last decade or so, for sure. You said your friend's son was older. So I think in the medical model, there's always this. So two things. One is, like, as you mentioned. So I trained in the medical model. Actually, I didn't think psychiatry was like the last thing I thought I would actually wind up. And I was very much more medical, surgical, that kind of stuff. Heart surgery or bone surgery. Those are my kind of things. So I kind of fell into psychiatry only kind of later in my training. I talk about that in my latest book. But what I'll say about the medical model is really focused on like the biology, the genetics, like thinking about it as a biological disorder, and neurodivergence, and thinking about less so about the kind of social and psychological components to it. That's evolving. That's evolved, but that's sort of how it kind of the foundation. So Wes is coming at it it came at it from a very different lens. I will say that there's much more overlap, as time has gone on, and the people in the advocacy community have often driven some of those changes, as he was mentioning. Back to that terminology, like, in medicine, so like there's this whole thing about stigma. So like if you say someone, and it comes from the issues of like, often in the world of addiction and drug use, like, is this person an alcoholic? Are they an addict? Are they a junkie? All these sort of terminology that you see. And so medicine has been shifting in the last, decades or so to say, well, no, this person has an alcohol problem or an alcohol use disorder is what the terminology is now. And so it's been this way of trying to like destigmatize things. And so I think initially the medical community was doing the same with these things were called neurodivergency. This person has ADHD or this person has autism. And that was sort of it was a way to sort of avoid the stigma, right? But what we're finding is that in communities, people are often actually approaching this identity first. And so we've had to kind of adjust to that. I actually this is funny. I was on a TV, I was doing this consulting for a TV program some years back, about 4 or 5 years ago, and they had a case with autism, and I was still thinking about, well, this person has autism, and then there was some other consultant on there, was like, no, I'm autistic, and so there's definitely been that very much that sort of change and switch. What do you think's behind that? What do you think? What are the reasons behind that switch?
Well, so like first for me, I accept both. I use identity first, but I have clients who use all. What I think is behind it is the fact that we're not, when I say we, I'm mostly talking about Black folks, but really folks who are at the margins of society aren't really included in a lot of these decisions. So I was telling Raina about this. This is one of the many things I'll ramble about when I get on my soapbox. The first person who was ever diagnosed with autism, I forget his name. It was a white man. He died in 2023. He was 89 years old, right? And so, there's some things that we know about this. I use the word condition, but there's some things that we know about this condition, but there's a lot that we really don't know. We're really still understanding this at a deeper level. And this was a white man in Alabama whose dad owned a bank, and he had what we would later call Asperger's, which in the DSM-5 is not a thing. It's just autism spectrum disorder. And he went to college. He graduated from Alabama University. He worked at that bank that his dad owned and ended up managing it until he died, right? My maternal grandfather, these weren't rich folks, but he was allegedly really smart. I knew he died when I was about 14. He was one of the first people to work for NASA. All right. This man ate everything off of a plate. And he could describe to you the mathematical reasons of why eating soup off of a concave plate when the soup was at a certain temperature was much better. This is not neurotypical behavior, right? This man was autistic, right? But we weren't getting labels like this. We know sexism is real. We know racism is real. We know all these other isms are real. And so when we have these conditions that come out of this, space 80, 90 years ago, we're not included in how we're seeing these. And so we're at an age right now where things might be more fragmented, but also people have a stronger voice. You can go on social media and you can hear a lot more about other people's experiences. And you have, folks like Doc and myself who are in these spaces now are like, nah, this is a little bit different from how we see. And I've read your second book, and in your second book, you talk about that too. It's like, there's a stigma behind these things. And so even as practitioners, that stigma exists when we talk to other practitioners, and it's heartbreaking, and it hurts the clients and patients that we serve. And so when we are working to deconstruct these stigmas, it is for the benefit of our clients. So that's what I see.
Dr. Tweedy, I want to hear how this aligns with what you discuss in your books, but also, do you think it's a good or a bad thing about the language? Because does it make it no longer valid, right? Because I think, is some of this real? I don't know. There are a lot of people on social media that diagnose themselves. They might take a quiz online. It might not be legit. Do you think this is real? And do you think people that are neurodiverse are actually special needs? Do you think they are truly special needs? Because that's a term I have an issue with.
Oh gosh, man, this is pretty. This is
deep
stuff.
15 questions. Sorry.
No, it's deep stuff. No, I mean, there's so much to unpack. I mean, I probably won't be able to get. We'll have to kind of come back and forth with some of it, but
yes.
Special needs does have. I don't know, but I mean, like things only words in themselves often can be neutral, but it's like what we kind of attach to it is more like can be the problem. Like like if a patient wants this autistic, on its face, Why is that bad? If that's how someone wants to be identified, what's it's only if we attach certain things to that, then we take this label and then we say, oh well, that means this person can't do this or they can't do that or they're this. And so those are we're taking extra steps, right? In and of itself, the word doesn't mean anything. We're taking these extra steps, and we have to sort of check ourselves and think about what that means. What do those extra steps mean? Just to give you something, this is a little bit on a little bit tangent, but like in my field, like in psychiatry, there's all sorts of labels, right? Bipolar, schizophrenia, and so we attach certain meanings to those things, and then determines how we then approach a person. But that's on us. Like what I'm arguing for is we have to be much better about how we think about these things. Everything's like there's in terms of spectrum. Everybody's still an individual. You have a label, but you're still an individual in all sorts of ways. And I think what the danger comes is when we, and it's just like with race, right? The danger is when we take these labels and then we sort of apply all these other meanings to them, and then we then sort of limit people and constrain them and reduce their aspirations, and we discriminate against them based on these things. That's the real problem. The terminology itself isn't the problem so much as how we apply it. This is also really important message. What am I doing wrong? How can I do it better? Being open to to thinking about that in a way, and I think that's what I'm trying to teach. Because we come in doctors, we're often so like we think we know everything. We're the top of the class, and we're this and that and the other. But you got to have some humility about all that, man. And so this is how I kind of approach all this stuff. So I love to hear from people, patients, people in the community. And so tell me, Wes, where am I missing? Where am I wrong, man? I want to hear. And when you do the same, tell me what I'm doing wrong.
Yeah, I appreciate that because I've had some experience in some integrated health spaces, and I'm butting heads with the physician and the physician's assistant. Like, I don't think y'all are really understanding this dynamics of this person's mental health challenges that they're experiencing. You are seeing it through a very specific lens, which has validity, right? And so that very specific lens is the medical model. Right now, like a lot of people in my field, or I'm saying my field, my lane of my field, people who are under this umbrella of the neurodiversity movement, a lot of them are very anti-medical model, and I can understand. I'm not anti-medical model. there's pros and cons of everything. And 100%. There's pros and cons of the social model of disability. The social model of disability is like, hey, disability isn't real. Our society creates the feeling of disability. And like an example they would give is, if there was ramps all over the place, folks who were in wheelchairs wouldn't experience a lack of accessibility to certain offices. If you went to a community that was built by and for folks who were blind, and you as a sighted person went there, you would feel disabled. And so, yeah, that has some merit and some validity, but there's other conditions. I don't know the names of all these conditions. I'm not a physician, but like there's conditions where like you have brittle bones and your bones will break. That has nothing to do with the constructs of society, right? And so I think that there's a push for the biopsychosocial model because it's combining all of these things, right? But if we look at the history of this, and I'm like a sociological person too, so I love looking at the context and the history and how we got here. And so you got like in the 70s, you had the disability movement, and that really started gaining ground. In the 80s, you had the autistic movement, which really started gaining ground. That led to the neurodiversity movement, which was originally coined by Judy Singer in the late 90s. But there's all types of movements that are related to that. Intersectionality by Kimberly Crenshaw in 1989 is a movement that is examining life from Black women who have these dual identities that experience marginalization. It's like, no, we're seeing something different. So what I really see is folks who experience life at the margins for a multitude of reasons and identities are saying, we need to be included. We have a right to have healthy, productive, and meaningful lives too. And when some of us can squeak by and make it, we do amazing things, right? And so, hey, let's try to make this, let's try to create more equity here so that we can all have access to some of the supports. Because so I think about someone like me, like I'm ADHD, but I didn't get my diagnosis of ADHD until I was in a PhD program and something happened to me. It's a long story. And I'm like, I'm not going to let this happen again. So I went and got my diagnosis, and I'm a very athletic person. I'm really good off the cuff. I'm great. I'm good at sports. I grew up hunting and fishing. And so we have these theories of like these cognitive conditions like ADHD were great when we were hunters and gatherers, right? Now, if I was living in the village where I had to hunt. I go out, I do my hunt, I do my thing, I come back, my brain is pretty much done. But I don't have to then get dressed and go to work and make a living. I get to be supported off of the village, the community that I'm a part of, because I've done my part to contribute. Our society is not quite constructed like that in this form. And so it creates a lot of stressors that bring out physical conditions, that bring out mental health conditions. And, you know, in Western medicine, we tend to not combine the mind and the body, right? And so I think part of this is, hey, these things really go together. They really do go together, and we need to be really intentional to push the envelope so that folks can say, no, okay, maybe there is something to this. Okay, what's wrong with saying that this is my identity? This is not a cold. I don't get rid of my ADHD. It is a part of me. And honestly, it's a lot of my strengths. There's a whole nother component to this where people are getting missed. And we know that there's subjectivity, and we know that there's bias when we look at a lot of mental health conditions. I think this is just people gaining more power, more access, and they're saying, no, I'm going to get my support.
How do you feel about, as a mom of the two, you know, how do you feel about these labels and this what we've been talking about?
It's a blessing. It's a blessing and a curse, right?
Okay.
And not only do I have Black boys, but they're biracial. It's funny when you're talking about the stressors, right? And say about my oldest son, my one that just got home from camp, I think he's just like my husband. But the difference is my husband grew up in 80s and 90s Glasgow, Scotland. So he didn't have the same issues because guess what? There weren't the same stressors. Environmentally, culturally, socially, he didn't have an alpha type A Black mom all up in his mix trying to get stuff going. I really struggle with the school situation. We are very blessed. We have resources. I was ahead of this stuff, right? When people around me were saying, oh, everything's fine, or they all do that. They all do that. I hate that. Having grown up the way I did, being pretty much the only pigmented person, I had already learned, and this is not something I don't say to my white friends, like, that's great. You guys can be okay with this, but I have to be twice as good as the next person. And I've really been through a journey with the schools. There are things that go really well, things that don't go well. The main thing that I struggle with now is the fact that I've gone through all of this to get them the support they need, right? But I don't love that it's all under a special needs category, because something I say to babysitters all the time is, my kid isn't special needs. He just has some needs that are special. Let's not bucket him, because he's going to spend the rest of his life being bucketed anyway as Black men. And it's a struggle. The other major part of it, it's the social part where I'm worried that people are going to bucket them anyway as Black males. It's the school thing, but also there's also a struggle within the community. It's always a fun exercise to see how people of color deal with this situation. I have to say, I'm blessed that my family, my parents in particular, they read all the articles I send them. They've gone as far as to talking to our parent coach. I mean, they get it. They get it. But
that's great.
You're saying, Wes, I mean, the little one has the same behaviors. Quite frankly, I do. He's just 20 times smarter. But my grandma's brothers, he reminds me of my grandmother's brothers, used to hear about the Jones. Oh, they have the Jones in them. Oh, you know, they're kind of evil. I'm like, well, what does that mean? Well, you know, just Jones evil, right? Or, you know, you would hear stories about, well, sometimes they would do this and they walk off that. Now that I know what I know, I'm like, oh, that means they had rigidity. And oh, no wonder all the engineers came from that side of the family. And no wonder, you know, some of these like behavior things they had, that's what it was. But I'm sorry, when you were sharecropping in the 1920s, no one was taking you to a neuropsych. So,
right.
You know, on one hand, it's a blessing, but I feel like I'm constantly trying to curate how the world sees them, how I'm preparing them for the world, and then getting upset because I don't know if the world is going to accept them. It's like the normal struggle that any mom has, that any Black mom has, but then squared. It was interesting. It was this week, and we were going to the airport because, you know, we're getting ready to go see my in-laws in Scotland, and trying to get something called global entry, right? You have to deal with the TSA officers, right?
Right.
And we get there, and, you know, tall, handsome, bald Black man is the officer. I'm like, great, we got this. He kind of said, hey, how are you, son? And, you know, my son doesn't right away look at him. He, you know, I could tell he thought my son was disrespectful at the end, because as you men know, I'm not very shy. He said, well, do you have any more questions? And I said, yeah. I said, have you ever heard of neurodiversity? And he's like, well, yeah, I have. he said, but everybody makes their own choices. Plenty of relatives that I know and people I love that love them that just think, oh, well, they just don't rule him in. He's a little bad. It's something
that Raina is some of the exact challenges that I fight against with the mental health piece, right? Is we all exist in a sociological context, right? Some people want to deny that sociological context, but we do, right? And the history of the U.S. tells you what that sociological context is, especially for Black folks. So we're conditioned in a certain way to respond unless you get some training, some therapy, you get a loving and kind, supportive parent, or some other things that helps you to kind of move out of this space, right? But this, hey, you got to be twice as good, right? The Black excellence thing, regardless of what's going on with you. Hey, we all have nuances, our own idiosyncrasies that are going on. And like the DSM-5, like all these things that are in there, this is what I say to a lot of clients who have fear and hesitation about these things. When you look at all this stuff in the DSM, everybody has aspects of these things. These are just aspects of humanity and behavior. What makes it a specific condition is the concentration of those things at a certain point in time and everything like that. These are just our body's ways of responding to the stress of life. And so when you say like earlier, like, is it real? It's real in the same way that race is real. Race is not real. It is a construct that we created, but we can see that we have phenotypical differences typically.
For example, our society uplifts Elon Musk with all of his flaws because he's smart, right? I don't know if you've read Bill Gates's biography yet, but the stuff he talks about sounds like both of my boys combined. In this world, in this society, they're uplifted for those things. I know that my children will not be. And listen, there's a fighter in me that's not happy about it. Dr. Tweedy, your books touched upon this. I want to tell me a little bit about your journey, and you can even go back to childhood about what your journey and insight on this has been.
One is I hope that your boys are still young, and I guess I would hope that there may be that, in 15, 20 years that there will be some difference, right, in how that's viewed. Because your point is well taken about how there's certain these business people and titans you described, and how they definitely have some neurodiverse types behaviors and whatnot. I come from a very blue collar family in origin. Go back to, I can trace my family back to into the Civil War sort of thing. And my grandmother will say, who I knew, and she growing up, and she didn't pass away till I was in my early 20s. This whole issue about mental health, she would say, life's tough. And you don't have time for that kind of stuff. You don't have time to be complaining. It's hard on Black people. Life's not fair. It's never going to be. And you got to toughen up. And so, she had and she would say that because one of her daughters, my aunt, had struggled, all kinds of things that we would call depression. We would call it, panic disorder. Right. I was like, there's no time for that. You got to be strong. And so there's definitely an ethos of that within our communities. Many of our people in our communities who come from that. And so there's a struggle to embrace anything that may be seen as something that's a deviation or an impediment to making it in this world, right? And so there's often, it can even be a resistance to labels for that reason, but also because who's giving these labels? It's often a quote white medical establishment that we don't, they've done bad things to us, and they're trying to drug our kids, and and what's next, right? And so there's definitely some strain of that is still there, right, in different pockets of our community that is an impediment. There's also the reality, though, that on the flip side, that the medical community, whether it's teachers or whether it's the medical community itself, the same behavior. You mentioned Bill Gates and Mark Zuckerberg, right? I'm sorry, Bill Gates and Elon Musk. You could probably throw Mark Zuckerberg in there too, but yes. people will the same behaviors. It can be two people can be doing the same sort of thing in terms of behaviors, but they can be interpreted very differently depending on the person's parents, who the parents are, the kind of school they go to, their socioeconomic status. And so the white kid might be seeing this is a really bright kid who's he's got all this talent. We just need to figure out a way to channel him this way. The Black kid might get a whole different get a different label and get put on a whole different path. And so these are also historical realities that while we are improving because we're acknowledging and trying to address, and they're still very prevalent. And so that also, so I can see you as a mom of Black children. I can totally see where you can sort of have those kinds of concerns. I think what advantage you have is that you are in this space. You sound, you're obviously very, very intelligent, very eloquent, and can advocate in a way that other people may not be able to advocate for themselves. So these are the reasons why we see these disparities in terms of ADHD, who gets diagnosed with it, who gets treated for it, what pathways they go on. I mean, all these things are very real. And so these are all the kinds of things that I think are really, really important things to me. For me personally, I was, looking back, I always had some things that probably were considered off. But I was, it didn't impact my ability to do well in school. I was really, really strong in math in particular. But I had all sorts of sort of, kind of, it might be called eccentric behaviors, but I was able to sort of mask it in a sense. One that I was, it didn't impact my actual grades. And secondly, I was also, became a good athlete. And so that was also a way to sort of mask it and people could be socially acceptable. Yeah. Oh, he's cool. Even though he's kind of this, he's cool. He plays basketball, whatever. And so those are ways that I was able to sort of mask that and kind of fit in. But in terms of my actual day-to-day life, there are all sorts of stories of like, whoa, looking back, like, one day in class, I was so into this material that, I had this sort of, my bladder was full, but I was so into this material, and it's like, next thing I know, oh, there's an accident. And what the hell just happened? But I was that's obviously kind of an unusual.
And how old were you? Were you I was older when that happened?
Fifth grade,
Yeah.
Old enough to know that that's not what you're supposed to do.
Yeah.
But I was able to kind of cover for I was able to mask it somehow. I don't know how, but no one ever found out other than my mom. And my mom's like, what's wrong, boy? You smell bad. What'd you do today? And so, and there were also other sorts of things, but my mom didn't ever think about the idea that maybe, she would never consider the idea of like taking me for an advice. It would have never once crossed her mind. She would have just said, he just kind of, boy's odd. But he's doing well in school. He's staying out of trouble. So it's going, but she's still worried about me a lot, because, I would be the one I would forget keys. Like they didn't want me to drive because, they knew I was going to leave the keys in the car and that happened. One time I actually left the, I left the keys. My wife's got a story where, I actually left the keys in the front door. They left the door open. And I was, she was like, she got home. She thought, man, did someone rob us? Did something happen to me? So I left the shoes in the car one time and actually was driving the car. So all kinds of things that are like that. But I've been able to sort of, you can call it. I mean, people want to use the word masking, just because I'll be able to sort of function in a way. But no, it's actually what I found is I've had kids. You get more things incoming. It's gotten a lot harder to manage. It's a lot harder. And this goes back to the sociological that you're saying, Wes, about like if you're just doing one thing, you can do it fine, but you start getting the incoming in our society's complex. The last thing I'll say, and I'll stop, is that I think, when we say special needs, I had because I teach these medical students, and I think a lot of younger students are really getting it in a way that people in my generation didn't. But her whole presentation, the thrust of her presentation was that, and she's not going to psychiatry, she's not going to be a pediatrician, but the thrust of her presentation is that what we are trying to do for people who are quote neurodiverse or quote special needs is actually stuff that is shown to be beneficial to everyone because we're all. So I thought that was such a really important point. And it was like, wow, she really got it. And she was teaching a whole group of students, and they all like, wow, this is really interesting. We never really thought about it that way. One professor actually had that feedback. He said, I never even thought about it that way. This is really impressive.
I'm curious, do you ever get pushback? Because again, you're being very humble, Dr. Tweedy. What you're doing, this holistic approach, is not normal, right? That's an exceptional approach.
But I want it to be normal. That's the point. In my generation, doctors, yes, pushback, right? Much less as you get younger and younger doctors. I mean, I have these people I'm training, they're going to like orthopedic surgery and neurosurgery and they get it. And it's nothing that warms my heart more than to go to an audience of doctors who are not psychiatrists, people out in other specialties. And they're the ones, and they come up to me like, man, this is so important. I really get this. Thank you for doing this. So I think there's a ground. So I think there's a shift, I think the people who are sort of coming up on that path are really getting this more. So I'm really encouraged by that, to be honest with you. Really encouraged by that.
Well, random thought. I know you said language was fluid. I hope that Skibbity Toilet and Sigma sooner than later.
I'm way too familiar with that, and I'm so disappointed that I am.
So what's the fix? I mean, I know, Wes, you talked about advocacy, but what is it that the average person can do to help with this? And what are steps, if there's anyone watching this right now of any pigment, but especially of color, what should their next steps be to kind of help themselves or their family approach this issue?
There's a lot of different ways you could approach it, right? And so my feeling is you need to get curious, right? And getting curious means that you're removing some of that defensiveness of like, oh, this is bad. Oh, I know that the older Black folks were like, hey, you just got to get over it. And I respect we call them the Afro Hicks. I grew up kind of country, so these were the country Black folks, the Afro Hicks. So like, I respect I respect my Afro-Hick elders because they had to do that. That's what they had to do. I don't have to do this anymore. Okay, all right, exactly. Right. You did that, so I could do this. Right. So get curious about it. Right. Get curious and remove that stigma. The other piece is, you had said it before, of like, these are things that everyone needs. And so I've done a lot of business consulting too. So like I also teach some master's level classes for incoming counselors at the master's level. And I've done some consulting on the business level. So there was Dr. Nancy Doyle, who's an industrial organizational psychologist. She runs this firm called Genius Within out of the UK. It's like the world's largest neurodiversity consulting firm. And so I've worked with some clients through her. And so one of the things that we push through the data, through the studies, is when you implement these supports, they benefit everyone. And so what I want people to think about is support. We all need support. When you think about a high-level executive, they have an administrative assistant, an executive assistant. That is support. I think a lot of us would do pretty well if we had an executive assistant helping to manage our time and managing our calendars. Like, we all need supports.
Or they call executive functioning. Hello.
What they call executive functioning. So they're like, and especially as parents in this community, like as a parent, that need of support becomes really real, especially when these kids are young. You're like, oh my gosh, I'm not growing up. I'm not raising these kids in Maryland, where I'm from, where all of my family is from, as far back as we can trace, and we can go generations back. I don't have that support. I feel this, right? And there was actually a Trevor Noah quote like recently. It was like a podcast clip that's been circling around, and he was talking, and I thought it was a really great point. And this is something that I would also say to people, because I want folks to understand support is a good thing. There's nothing wrong with support. We got to remove this stigma of, I got to do it all by myself, that hyper individualism, right? It's like when we start having these societies that become more industrious and have greater, profits and GDPs, what happens is we lose a lot of the community, and then we have to buy the community back, right? You have to buy someone to help you clean your house. You have to buy someone to help you cook. You got to buy someone to help you with your kids. And look, I don't make as much money as Dr. Tweedy. Okay. So like, I can't buy all these things back. Okay. Right. And so I need to find supports in a different level. We all are really at a lack of support. And so when you're talking about folks who are farther at the fringes, whether that be women, whether it be Black women, Black men, Black people, all identities and all these things, when we're at the fringes and we're experiencing more, discrimination in certain areas, we need those supports more so we don't fall through the cracks, right? And so this is what I tell the parents I work with, it's not about special needs. You might hear that in other places. This is about helping your child and you get the supports that you need so y'all can flourish to have the lives that you want to have. I try to do a lot of my work with this budding concept of the band of Black and Neurodivergent as working outside of this area of I need to get a diagnosis. Right. Nothing wrong with getting a diagnosis. I'm not anti-diagnosis or anything like that. It's just hard for a lot of folks, whether cost or just logistics or just the stigma and fear. So it's like, let's just start with understanding these things and getting supports, right? Because a lot of times when some of us understand this and then we are able to identify community supports, we can work through these things in a different way. Now, I'm still a fan of diagnosis when you can get it, because it gives you more access to more supports. But really, to me, the conversation begins on support. Every human needs support.
Dr. Tweedy, what are your thoughts?
I love it. No, I totally agree. There's certain people for whom the diagnosis, the label is really important. It helps them sort of think about and organize things. Other people really run from that. And so again, I love the idea of framing like, okay, it's like support, like help. Like what do we like we know there's something here that you need help with. How can we just start with that and then move forward? You know, we don't have to call it this thing. If you want to call it this thing, I'm happy to do that and go down that path. But some people really, I think some people get turned off from care with that. I'm all about meeting the person where they are. If they want that label and go down the diagnosis path, which I think can be helpful, as Wes mentioned. I definitely am on board with that. But if they're not, I'm still on board with trying to find that support and help with them. And so that's definitely my approach.
I love that. And Wes, next time you come, we'll talk about the whole. I love that you're dealing with the British agency. As someone packing to take us over to Scotland to see my in-laws, where my kids look feral because they haven't been in school. The intercultural perception and terminologies and understanding of this topic is extremely interesting. And even my friends that are, Asian and Indian. I mean, we've kind of had some conversations sometimes about differences there.
Huge differences there, actually.
When I teach in master's level courses, I do a multicultural course. So I'm trying to help these incoming counselors understand how they're working with all these different aspects of humanity. And stories is a dynamic that all cultures understand. When I was in first grade, I had the benefit of having a grandmother who had a college degree and was a teacher. I took my very first spelling test. Now, long-term memory, short-term memory, working memory. My working memory, typical ADHD, not great. My long-term memory is oddly good, right? And so I remember this like it happened last week, gave me the spelling test, but the directions to me as someone who I think is more autistic minded didn't really make sense. They weren't as clear as I would have liked. So when she's reading the words, like the word is sure, are you sure? And I'm trying to write down the whole sentence and spell the word. And so I ended up failing this very first spelling test. The teachers were talking, and so it's like Sylvia's boy's grandson didn't do well. And she stepped in that room and was like, excuse me, no, my grandson is very smart. Like, let's find out what happened. This is not what's going on. And then she talked to me instead of people making decisions and thoughts and opinions about me without me there and without my context and without some warrants behind my experience. My grandma was like, no, I taught him. He thought he was supposed to have to write the whole sentence. And so they gave me the test again. I did really well on it. That is support. That is advocacy. What would have happened if I didn't have her? And at multiple intervals in my life, I had someone, also 9 times out of 10, it was a Black woman. I had someone intervene in my life and was like, hey, son, we're gonna help you with this.
We're good for that. That's why forever in a restaurant, we get bad service. My friend, since I was 12, I'm always the one that handles it. But I digress, as usual.
I think this has really been a great conversation. I just want to say that, first of all, this has been really great. No, I think, just to kind of reiterate, I think that, being curious, being humble, not just again, labels, these, diagnoses, doesn't mean. I think the challenge again is that sometimes we take a label and what do we attach to that then? And then we attach these negative things to that. Then that's where we run into the problem. So the more we can sort of be curious and open and think, well, this is a spectrum. Someone has this thing. Okay, they may have these things, but they may have these strengths, and not just thinking about the diagnosis only as a form of like weakness or disability, but also as something that also can be a form of strength in its own way. And the more we can optimize all of that, I think that the better off, we'll be with all this stuff.
Well, it has been a blessed miracle that 3 people with neurodiversity have figured out how to get a time on the calendar. Looking forward to continuing this conversation with you and its many aspects, gentlemen.
I would love to continue the conversation.
Likewise. Thank you for having us. I appreciate this.
Thank you. Have a great afternoon.
All this phallic repetition, or you tell yourself a tale or two. Man like you.
Word on the street is that some places in the UK, England, Scotland, and Wales in particular, are getting some new rainforests. I'm in Scotland right now. I couldn't imagine that it needs any more rain, but if you Google it, you can see why it's a good thing. The Bowden Pillars project, which is being piloted in the region of Devon in England, has so far planted over 2,500 saplings, and there will be 4,500 other new trees planted by the end of the winter. Now, this rainforest, which is similar to rainforests that apparently existed thousands of years ago in the area, are being planted in partnership with Aviva Insurance. I think it's a wonderful, beautiful project. It's great to take good care of our earth, and it's great to see that business and government can work together for good. Thanks again for joining me here on ABG. We are actually now on Substack. Check it out and have a great day.